I am pleased to be here today with Ron Henry, who's the Chief Development Officer for North Fulton Hospital, and also Kamela Sooknanan, the Associate Administrator of Clinical Quality Improvement, also for North Fulton Hospital. Thank you both for meeting with me today. One of the reasons why I wanted to meet with them is because they are currently developing a program in their community that's specific to the senior care community. And Ron, would you tell us a little bit about that program?
Sure. You know, North Fulton Hospital has been in this community delivering health care for more than 25 years. One of the core elements of everything that we do is really focusing on what care we deliver, does it meet the needs of the community, and it being of the highest quality possible.
Certainly.
As we look at our community, and really this is a phenomenon across the country, but the 65 plus population in our community over the next 4 years will grow by greater than 48%.
Wow.
That's the largest growth of any age group.
Wow.
And so at the same time, the providers that deliver health care to that community is either staying flat or not growing at all, decreasing. So we really saw a need out there. We also saw a need, many of our, basically a third or greater of our admissions to this facility is in that population as well. One of the issues that we saw was that our care providers, our care partners in the community, the senior living facilities, didn't understand our expectations when they, one of their residents was admitted to North Fulton.
Sure.
And we didn't have a complete understanding of what their needs and expectations were as well. So we started this program and this journey about close to 2 years ago now. In October it'll be 2 years. And listening to our community and care partners, looking at where our community was growing, and looking at opportunities for expansion of North Fulton Hospital and playing to the strengths that we had.
Certainly.
The primary among those was quality. So Kamela reached out to our care partners, and we started a program called a Care Transitions Task Force. Basically developed for a couple reasons. Number one, to increase the communication between the care partners, drive the continuity of care, and really through that increase the quality and the outcomes related to the care for those patients.
Wonderful.
Tremendous success.
Yes.
That was really the basis and the strength of this program, and still is today. When we started that out, we had about 5 or 6 facilities. Today we have over 20, and more want to join all the time.
That's wonderful.
The impact of that has been tremendous. The next phase of that was meeting the needs from a physician perspective of that population. So many times we heard from the senior facilities or the residents, I need to find a primary care physician, or I need to find a specialist, and I call 5 and 6 physicians, and they're either not taking new Medicare patients or not taking any Medicare patients at all. And there was a frustration and an inability to access health care. And as a care provider for this community, it's our responsibility to try to resolve that or try to fix that problem for our community. And so we developed a senior care network of physicians, both primary care and specialty physicians, that take Medicare patients, that can return calls and respond to requests for appointments within 48 hours, for example. And that will participate with us in outreach and education to our community. We started that in March. That continues to grow. We continue to add providers. We continue to reach to the community. A community member can make one call, one number, and they'll be connected to these physician offices.
Wonderful.
And then the third element of this program was our ACE unit. And we're sitting in the day room of that ACE unit right now, which is a critical element in the delivery of care. But it really brought together, under Kamela's leadership, the strength of this facility and the strength of our team, that we care and we specialize in the care to the people of this community. The ACE unit focuses clinical care on an inpatient level to a senior community. We address needs of a senior patient when they're in our facility, and Kamela can get into those points with more specificity. But I think in general, those three elements were necessary to make this program comprehensive. There is still a horizon and growth that we're looking at, but our focus is being as comprehensive as possible, being recognized as a regional resource. We're gaining attention outside of the region,
Yes.
because of the nature and the comprehensive focus of this program.
Right.
And so we're excited about it. This is one of the most exciting things that I think I've done in all the years in healthcare that I've been doing this. And but it was really a passion of ours, and it really, we feel, meets the needs of this community and a very important segment of our community.
Absolutely. I remember listening to you speak at the senior networking group, and one of the things that struck me was that there's nothing like this happening right now. And I saw the energy and enthusiasm that you all brought to the table behind it, and I thought, I really want to get this in front of the audience of my community, so that it can see what's going on here at North Fulton Hospital, and hopefully there'll be an opportunity to reinvent this for other hospitals as well. But I want to focus my attention now to Ms. Kamela, who is actually the driving force behind this program. And I would love for Kamela to just share with us in detail a little bit about the three-prong approach that you all have implemented. And I know the first approach is the Care Transitions Task Force. So if you could just give us a little more details about the task force at hand.
As Ron mentioned, 2 years ago, coming up on 2 years in October, the initiation of the task force, or the development of it, was driven by the feedback we were getting from community members and all the facilities that are here. Our hospital is nestled among a lot of senior living communities, so we exchange patients back and forth all the time. We wanted an opportunity to bring all the care providers to our table once a month to get their feedback on how we can better meet their needs, how we can partner in improved ways to optimize the patient outcomes. Really, that's what brought this all together. Another element of the development was pulling together all of the government pieces that were going on, all the aspects of all the evidence-based medicine programs that we're involved in, everything that's being publicly reported right now. I saw, as clinical quality director, I saw that there was a lot of duplication that we were doing based on breakdown in communication, either for when we were sending patients out or patients were coming back to the hospital. And there was a need for us to build systems that we all agreed upon, that we can communicate and exchange the information more timely, so that we decrease the duplication, decrease the effort, and in the long run, we were also helping healthcare cost and reimbursement and things like that.
Absolutely. How many members do you have in your task force currently?
Over 30.
Wow.
I would say now. Not everyone comes every month, but we have a pretty packed venue monthly. And we've, when you're bringing a bunch of providers together, we had to set some ground rules. And collectively, it's not our approach to this task force. It's not the hospital's task force. It's a community task force. We lead it and we own it, if you will, but it's a collective effort from all the partners there. So they get an equal say as to what occurs that we do. So collectively, we set some ground rules together.
Okay.
And one of the ground rules that we wanted to keep this particular meeting clinical in nature.
Sure.
And we focus a lot of attention on doing just that.